Hello, and thank you for tuning in once again to the video blog. We're now at week 1 after initiating Maercks Multimodal Therapy, or MMT, on the right half of my body. For those of you just catching up here, Maercks Multimodal Therapy is a series of high-technology, non-invasive skin tightening and fat and cellulite reduction technologies that are applied all together, along with a patent-pending monitoring system that allows me to get very, very, very fast results from non-invasive technologies. Last week we showed the instantaneous results, which you may or may not think are significant, but are really, really good for immediate results. Now I've had a week of healing and a second round of therapy, and right now we're going to take a look at the results and see what you think. Here we go. Hi, welcome back. This is week 1 report of Maercks Multimodal Therapy. We're actually at day 9 today, which is Saturday, and we're going to review the changes in my body. Again, the right half of my body has been treated with 2 rounds of Maercks Multimodal Therapy, or MMT, and we're documenting the results week by week. The last edition, week 0, was the immediate results. And what we see is kind of more the same, except for perhaps a little bit more defined and a little bit more obvious. So again, I'm gonna trace this shadow that you see here around this fat pocket, which is becoming a little hard to trace. And then again, we're going to do this, trace this fat pocket. I see this light reflex all the way up here, and you see this. I want you to be able to see this before I mark it. You see a shadow coming here, and a shadow coming right here. So this should be very obviously smaller than this. Again, the little pinch test, that's in fact obvious just at plain view. At least it should be. If I take this fat pocket and squeeze it versus this fat pocket, I think you'll find this is smaller. Let's look at the side. We trace the side fat pocket, something like this. And if we go over here, it's becoming hard to find. Something like that, but the skin tightening has taken effect so much that I really can't see that superior border that I can see here. I hope that comes across. And then as far as further definition, the pectoral fold, again, this is so sharp, even more sharp than last week. And we can even see the definition of this superior piece of rectus here and the border of the pec. And here, I can't, well, if I flex really hard, you can see that comparatively. Again, here, there's a lot of shadows here, a lot of rippled shadows. Take a look at the crinkly skin here, and really it's almost gone here. Interestingly, you see right here, I have a lipoma that I never noticed before, but now with the fat reduction and the skin tightening, I'm probably have to cut that guy out because he's sticking out there. As far as the lateral definition, it may appear more or less defined, but the really interesting thing is compare the skin quality here, the crinkliness that you cannot see, with here. You can see the multi kind of loculated pattern here of the subcutaneous fat and the loose skin, and really it's hard to be impressed with that. Here you see some sharp definition along the borders. Here I can't make a vertical line to describe a border of the rectus. You can see the rectus appears to go something like this. Of course it doesn't, that's just all the fat skewing it. But on this side we see the sharp line here. Drawing in the mirror is challenging. And if I try to flex, you know, these fat pockets really skew it, but here you can see some sharp definition. Now again, this is going to continue to improve, but what you can barely see here is the border of some fat here. You see, you know, the groin crease here, the groin crease here, but you're starting to see some definition here that is not apparent here. Let's do some simple measurements. Again, these are not the most accurate measurements you can imagine, but if I grab this fat pocket and squeeze it tight, use the calipers this time, and I got exactly 4 centimeters. If I do the same thing here, I get 3.3 centimeters. So about 0.7, about half a centimeter difference. We noticed that last time. Let's take a look at this fat pocket over here. And everything wants to read 4. Just over 4 centimeters. And this fat pocket here, this is really impressive. Under 3 centimeters, so over a centimeter difference in the thickness here, and I think that's very appreciable. Then again, you can see just the shape of this abdominal bulge here, the indentation here, and if you look here, it's a lot lower. If you can see that, so it goes in here and comes back out. That goes in here, so the fat's been reduced, the skin's been tightened, and really this is the kind of result that's pretty close to what I used to get at 6 weeks with a single modality treatment, such as infrared light, skin tight, one of my favorites. That's part of the Cyton machine, and really any skin tightening modality. But by combining the deep, intermediate, and superficial treatments, we're only at 1 week status post treatment, which really is just the tip of the iceberg, and we're getting significant results that on pictures would not be very disputable. So I look forward to seeing you next week, where the results will certainly be more impressive. I anticipate that this guy will be tiny next week, and for those of you that are still not really convinced, you will be convinced next week. And we'll have some 3D photos that we're going to take today and present, where I cut my body in half on the picture and show my body with 2 lefts and 2 rights. I think that will also help in displaying the results. Again, if you have any questions, concerns, comments, we welcome all. Thank you, and I'll see you next week.